My name is Kenan Stern. I'm an assistant professor of pediatrics and radiology, and I'm the head of the Non-Invasive Imaging Division and Congenital Cardiac MRI program at Mount Sinai Kravis Children's Hospital. So an echocardiogram is an ultrasound-generated image of the heart and the major blood vessels in the chest. It's a common test performed in evaluation of children with known or suspected acquired or congenital heart defects. Gives us detailed evaluation of the anatomy, structure, the function of the ventricles, the blood flow, in order to really pin down what might be behind a patient's cardiac symptoms or to follow up their known heart disease. So we take pride in our echo lab on the expertise of our sonographers and our physicians who are overseeing and interpreting the examinations. It really comes down to the knowledge, the experience, and the know-how when performing complex congenital echocardiograms. We have expert readers who are trained in advanced cardiac imaging, overseeing these examinations. We have experienced sonographers who only perform congenital and acquired heart disease echocardiograms all day, every day. So this is what we do day in, day out. We know our stuff and we pride ourselves on getting it right. So collaboration is essential. It really is a team sport, pediatric cardiology and advanced cardiac imaging. From the beginning, we're collaborating with referring physicians, making sure we have complete and thorough history and understanding the reasons and indications for the examination. What specific questions do they want answered by the imaging examination or echocardiogram? We collaborate with our sonographers prior to and subsequent to an examination to ensure that we hit every item that needs to be answered in that echocardiogram. When I have questions, I collaborate with my colleagues who are sitting right next to me, experienced expert congenital cardiac echocardiographers that are available at a moment's notice. When I have a question that I think might not be able to be answered by the echocardiogram in front of me, I collaborate with my colleagues in advanced imaging. Dr. Jen Cohen, who performs cardiac CTs, Dr. Aaron Paul, and I also perform cardiac MRIs as well. So we have kind of 360-degree expertise in echocardiography and all the complementary modalities, starting with a patient, starting with a referring physician's question, all the way through until we make sure we get the right answer. If a referring physician wants to know what's going on with their patient, we will provide that answer. We will figure it out. Now, that's our job. That's what we do. That's what we pride ourselves in. And everything we do is to make sure we answer those referring physicians' questions. We'll do that, as I explained before, with the highest level of expertise, sophistication, and understanding. We employ advanced modalities and techniques in our echocardiography lab, including strain imaging, advanced functional imaging, 3D imaging, exercise stress testing. We collaborate with vendors on developing new sonographic equipment. So we're really on the forefront and the cutting edge of using these advanced and emerging technologies. But when it really comes down to it, it's who's holding the probe, who's performing that examination, who's looking at those pictures and interpreting them, and that's where we really shine. And we do this all in a patient-friendly, patient-centered, family-centered environment. From the front desk checking the patient in, to the medical assistants triaging them, to the sonographer performing the study. We're really a family here, and we really treat the patient as the center of attention, as the reason we're all here.